Okay, so I'd like to invite Fred to give us his presentation about the environmental plans of the various parties.
Hello, everybody. I've already introduced myself, Frederick. And actually, so the presentation is going to be a very general one about what I think is how science and politics can mix up together for the benefits of the country as a whole. But as Gamali has said, I will, when I get to the environment sector, perhaps dwell a bit more because I've looked at some of the policy proposals in there. And I hope everybody can see my screen. Okay, so science and politics for me are two sides of the same coin. Broadly speaking, politics is the business of the people. Basically, at least in theory, that's what it's supposed to be, doing things to enhance the well-being of your people when you are elected into a position of power. Science, on the other hand, tries to solve problems for people. So science is trying to solve everyday problems that affect people, and politicians or politics itself is supposed to also try to find the best ways to help people. So for me, it's two sides of the same coin. It's complementary in many ways. And therefore, scientists should have it very easy moving into politics or influencing political decision making. But as we do know, that doesn't always occur, or it's not always the case. And part of the reason why that is not always the case is because sometimes people fear, for example, a scientist trying to go into the political arena or commenting on political stuff. There's a fear of victimization, especially if you are very active on social media and you try to critique or comment about government policies and so on. Then there's a tendency for people to put you in a particular box. So if, for example, now NPP is in power and you keep critiquing government policies on, say, environment or healthcare or something, people put you in one box and say, look, that guy is from the opposition. And therefore, there is a possibility of victimization and so on. So people tend to shy away in order not to be victimized. Then there is the issue of interest. Not everybody is interested in politics or influencing political decision making. So some people, though they have the ideas, very brilliant people, they are simply not interested. And in some cases, it's just people don't have the confidence to be able to take some of their output, their research and so on, and actually confront policymakers and say, this policy you're going to put out there, in my opinion, wouldn't work, or these are the challenges I foresee with those. And that confidence that lack of confidence comes from the fact that there may be pushback, and you don't know how that pushback is going to play out and how you're going to respond. But and so those are some of the barriers between science and policy decision making. It's not a linear thing. So in general, you think, I've gone to do some research, I know this is how things should work, and therefore I'm going to influence the decision making policy in this way. It doesn't always follow that politicians will even take your advice, even where they themselves have appointed you. Sometimes, and I can use the case of, say, in the US and even in the UK during COVID, there is evidence that some of the scientific advisors to Trump or Boris in the UK and elsewhere were giving particular advice to the leaders. And they also looked at it and said, if we took these decisions, it's not going to be inured to our benefit, maybe politically, maybe economically, and so on. So they may not take it. And that tells you that policy making itself is a complex process. Politics is quite complex. And so it's difficult for scientists to be able to influence it in the way we usually do within ourselves. And sometimes also part of the problem comes from the mode of communication. So science concerns itself with facts and figures. We take data, we want to deal with facts, we want to deal with figures and so on. And we have a longer time frame to work. So you can set up a study or a process that will take you several years to complete. The politician has shorter time scales. So maybe he has 4 years. He's won an election, or he or she has won an election, has 4 years to deliver a mandate. And your research is going to take longer time. And so they may not be able to wait for you to go through and come up with your outcomes before they implement their policies. They would still go ahead to implement them with or without your input, or even if your input would have helped to shape that policy in a better way. And sometimes one of the barriers also comes from feasibility. You tell them something or you try to influence a policy and they have to weigh it against the cost involved versus not doing anything at all sometimes. If I actually change this policy because of what this person is saying, how much is it going to cost us? Is it going to delay the process? And so on. So those are some of the things that go on behind the scenes. But then we cannot deny the fact that putting scientific knowledge as part of the policy-making decision is really beneficial because it helps us to generate national solutions to our national problems. So we define our own national problems and we fund our scientists to research into those national problems and then come up with some solutions. So those solutions are tailored to our particular problems and therefore it becomes more relevant. The decisions we make are based on evidence, is data-driven, and therefore likely to lead to better outcomes. And so there are enormous benefits that we stand to get by infusing scientific knowledge into our everyday political activity or decision making. In spite of that understanding that we need this kind of scientific knowledge in our decision-making process or in our politics, STEM policies often are not topical when it comes to elections in Ghana. And part of the problem is that it's usually not a top priority for the electorates. Politicians react to what the electorate wants. So if the electorates are interested in a particular subject, then politicians would gravitate towards that and try to find solutions. I'll give you an example. Recently, there's been a lot of talk about customers of the various banks and investment schemes and so on. Now, the reason most people are trying to find solutions to those problems is because there's a critical mass of voters in those areas. And their votes can determine who goes to parliament, who becomes president, and so on. So those issues are important to the voters, and therefore politicians react and find solutions to it. On the other hand, issues about, say, renewable energy, say, pollution control, climate change, and so on, are not really the most topical issues among Ghanaians. And so politicians tend to put it in their manifestos, as I'll tell you very shortly. But then don't make it the most important part of their campaign. They will put it in somewhere in the manifesto, all right, but then it's not really very important or at the top priority of the issues that they talk about during the campaign. But these are important issues like sanitation, just as I'm showing in that image. You can see there's a very sharp contrast between somebody, this was taken in Ghana, obviously. Obviously swimming in a flooded street with a huge poster behind him. But I'm sure if you go to speak to the people in this area, at this particular time where there's flooding, they would be concerned about issues of sanitation, environment, and so on at that time. But we really quickly forget once the dry season comes and so on. All of us, we quickly forget, and then the issues that concern us become things like employment or unemployment, banking sector issues, and so on, only for the problems to resurface later on, maybe the following year. And then we go back and we start demanding some solutions. So what I'm trying to say here is that we can determine what the politicians react to. And the way we can do that is to continuously sensitize our people that these issues are important for your health. Pollution directly affects your health. Living close to a polluted road, or even for people who sell in these polluted environments, your health is directly impacted. You're reducing your lifespan just living near a polluted street or living in a polluted environment. But people don't know these things often, and we need to consistently inform them. And when they become aware of these things, then they are likely to make it an issue. And once it becomes an issue, the politicians are likely to respond to it. The other thing, for example, is the campaign on the Tiwa Forest by the Ghana Environment, Youth Environmental Movement, AEROCHA, and so on. Recently, they were in Accra to do some sensitization event, and some people didn't even know about the Tiwa Forest or its importance for their source of water and so on. So as we make people more and more aware of the issues and how it concerns them personally, it will become more important in future elections, and the politicians are likely to react to it. The other issue is that currently, the way we fund science and research is woefully inadequate and not particularly helpful. Why do I say that? So currently, science is funded through book and research allowance. Every lecturer is paid a certain amount of money every year to do research. Whether that lecturer is actually doing research or not, they have to receive their book and research allowance. The other problem is that because you are paying it to everybody, you spread the money very thinly. So everybody gets a certain amount, but it's not really enough money to do any meaningful research. You can't buy any equipment and so on with the kind of money you receive as book and research allowance. I've just checked with a friend. The money is barely enough to even buy you a very good laptop. So with that kind of money, you are unable to do the kind of research that will solve national problems. And therefore, our researchers are often forced to look at funding from elsewhere, maybe apply for funding from the US, UK, elsewhere. And those research funding is often tied to the interest of the country funding you. So they have their national interest and they are funding your research. So they tie the research funding to their national interest. And this is the current system that exists. I've looked at some of the manifestos. As Gamali mentioned earlier on, I looked at 3 manifestos. One guy who has now been disqualified, and then the NPP and NDC manifesto, because these are basically the 3 manifestos out there. And there are various proposals for increasing research to research funding. As to whether they would become reality is a different topic. But again, we need to put more and more pressure on whoever wins the elections to make that research funding available. Because without the research funding, we cannot conduct the needed research. And if we cannot conduct the needed research, we will not solve the problems that we need to solve. And if we don't solve those problems, we would continue to be impoverished. So the proposal basically fits into something called the National Research Fund. The bill was laid in Parliament this year, and the proposal is that there would be a 50 million seed funding, and then every year there would be up to 1% of national revenue would be put into this funding, and then researchers can write proposals and so on to the funding and then get money to be able to do the kind of research that they need to do. And as I've just shown you, there are other proposed funds in the various manifestos. Again, it's a question of how committed these parties are to actually funding the research. And we need to put some pressure on whoever wins the election to actually make sure they go by their word that they've given in their manifestos, just as other sectors of the economy are able to push politicians to go by their word. Trainee nurses and teachers were able to push the government to restore their allowances. Other sectors, other groups of people have managed to push the government to give them certain incentives and certain things that were in manifestos. Equally, we as scientists or researchers should be able to push whoever wins the election and keep reminding them that you said you're going to set up a research fund, you said you're going to set up a science and technology innovation fund. We need it now. And so that is important. And it is crucial because it will grant us the ability to get the needed funding and independence to conduct research that is relevant to the needs of Ghanaians. And then I'd say Ghana has the capacity to lead, certainly in our area, in the area of things like renewable energy technology. There are various proposals in party manifestos about renewable energy. The NDC, for example, is promising to create a golden age of renewables if they win power. There are also policies about afforestation and so on. If we actually put the needed funding in, some of our institutions will be able to become world leaders in those fields, and then they will be able to lead, certainly in the West African region, because almost every country in West Africa has deficit in energy supply. And so if Ghana is able to lead in the renewable energy technology sector, we can easily lead people in Burkina Faso, in Togo, in Cote d'Ivoire, in Nigeria, etc., with our technology, with knowledge transfer and so on. And so that's something that we have capacity in. Parties have made promises in their manifestos, and we need to hold them to it. We also have capacity in waste to energy. Again, it's also written up in the various manifestos. We can also do things in agricultural technology, traditional and herbal medicine research. KMUSD has a very good department. The pharmacy department has a program on herbal medicine. Herbal medicine is actually very widely used across Africa and the developing world. So there's scope for us to lead in these things, but the research needs to be funded, and we need to put pressure on whoever wins power to be able to fund the research to do these things. And so there's a need for collaboration and also some pressure, and that's why I've put together various groups here. So if you take the NGOs like AeroCha Ghana or Ghana Youth Environment Movement, they tend to have an activist focus. Organizations like the Ghana Science Association or the Ghana Academy of Arts and Sciences, they tend to work more with government, and they tend to take the more traditional approach of dialogue, or let's sit down, let's talk. Even when the talk is taking 5 or 10 years, they are happy to let's sit down, let's talk, because some of them tend to be within the government itself. They may be working for the government in one field or the other and don't want to be too aggressive. But for organizations such as AeroCha and so, which are usually outside of government, they are able to put the pressure. And there's, of course, government sectors like the Parliament of Ghana, various select committees on science. There's the ministries that we need to work with. So we need collaboration, but we also need to put pressure at the same time to make sure things work faster. Yeah, so that's in brief, that's what I have to say. I guess when we get to the questions and discussions, then we can actually bring up more ideas. Thank you.
Okay, thank you very much, Fred. Yeah, you did a good job also giving us like a general background in terms of the topic, and then went specifically to some areas that touch on environment, but also like what kinds of strategies we must put in place in order to be nimble and target support for scientific research and technology that would really benefit the country. So I think that's really nice. I'll just open for 1 or 2 quick questions or reactions to Fred, if there's any. Okay, otherwise I would go quickly and invite Kwame to give us his input statement. And then after that, we'll have input statements from Andani and Paul as well. And then we can open up for full discussion.
Thanks, Kamali. I'm going to make this more of an interactive session. And I am doing so because anyone who has had an interest in health would realize that you cannot have a productive nation that is unhealthy. But for far too long, we have managed to relegate health to the background, where a lot of people do not seek healthcare as a routine. They seek it when they are unwell, which is the wrong default. Because if you seek healthcare as a routine, sometimes things are picked up long before they become a problem. And therefore, that particular mindset has to change. So let me give you a bit of background history. This was discovered in 1978, and that's how long it was, in Alma Ata, where it was realized that there was a serious discrepancy in healthcare provision across the globe. And so there was the Alma Ata Declaration, which sought to say that healthcare should be affordable and available to everybody. And as you all know, that was the era of the Cold War. So a lot of things were seen through the perspective of political lenses from the East and the West. So a lot didn't happen. Then after 1989, when the Berlin Wall went down, attention started to be paid to healthcare, especially in the developing world, because gradually we were lacking behind, leading to 2000, when there was the Millennium Challenge Goals, in which there were serious intentions to improve healthcare, especially around the area of HIV/AIDS. So a lot of countries, Ghana included, signed on to it, but we signed on to the Millennium Challenge under the late President Rawlings in 2000. But that was just before the general election, which then brought in J. Kufuor. And then they took over. And we all know about the M1 motorway and all that, which came as a result of that. But the interesting thing is we didn't deliver on the health components of that particular compact. So what happened? And why didn't we deliver? Because it was signed by another government and a different political color took over, which then meant that the actual commitments made by the then Minister of Health under Rawlings were not carried through, which was Nyamadonkor, were not carried through by Major Courage Kwashiga under J. Kufuor. So they concentrated on HIPIC and all the other things and to get the economy back on track. But then by the time they got to 2008, just before they were leaving, they realized that our health human resource to population ratio was nothing to write home about. I mean, none of our health indicators, from doctor to patient ratio, nurse to patient ratio, pharmacist to patient ratio, pharmacy technician, lab technician to patient ratio, met the minimal WHO requirements. So then the United Nations and WHO realized that this was becoming a problem, not just for Ghana, but across a lot of sub-Saharan African countries and lower middle income countries, because by then Ghana had gone out of HIPIC and was going into lower middle income. So what did they do? They went to sign the Kampala Declaration. That was in the dying embers of Kufuor. So they signed the Kampala Declaration, and in that, there was an understanding that the sort of healthcare that the developing countries or the lower middle income countries required, because of the lower median ages of their population, didn't need to rely too much on quality specialist doctors, specialist pharmacists and all that. And we needed what's called the mid-level health cadres, so that they could identify diseases long before they became complicated when these specialists had to deal with it. So we signed it, and that we committed ourselves to structurally changing the dynamics of our health human resources. What happened? 2008, the MPP lost the election. The interesting thing was that the global review of the Kampala Declaration happened in 2009 in March in Accra. By then, Professor Mills was president. There was no health minister because it was after the election, they were going through vetting and all that. So some chief director in the Ministry of Health did the review, and guess what? We just parked the Kampala Declaration. We did nothing about it. So fast forward 2015. Then former President Mahama goes to sign on to the Sustainable Development Goals, which was the first real commitment of countries to deliver universal health care by a specific date, which was 2030. So they signed it in 2015. They commissioned my good friend, Dr. Chris Atem and co to look into the NHIS if it could be a vehicle to actually deliver universal health care. By the time Dr. Atem and co delivered their report in 2016, we're in another election. Lo and behold, what happened? John Mahama lost and the MPP came. So delivery of universal healthcare was also put on the back burner. So by then we had gone 15 years with signing global declarations and undertakings with no intention of delivering them. 2 years into the NPP, they then went to Astana in 2018 to sign the Astana Declaration, which committed countries who were signatories to deliver primary health care cost neutral to all users by 2030, which was a coupling of universal health care. I have given this background to let all of you understand that the two manifestos trying to focus on UHC is not by accident. They suddenly realized that by 2021, when we have a new government, we have 9 years to deliver on promises we've been making since 2000, with development partner consequences. And we have no plan. Absolutely no plan. So now let's look at the different cohorts that they want to use to deliver, considering that both parties have had all this time. The interesting thing is the definition of universal healthcare. It is the delivery of health, especially primary healthcare, to a larger segment of your population, cost neutral at the point of use. And that's key, cost neutral at the point of use, which then means that if you went to access healthcare in any UHC system, whether you have insurance or not should not impact on your ability to access primary healthcare. However, if the primary healthcare leads to the identification of anything that feeds you further up the chain of health delivery into secondary, tertiary, quaternary care, then obviously if you don't have insurance and all that, you're going to be shortchanged. This is where the NHIS cannot deliver, because the NHIS, if you went to a health facility now and you wanted to use the NHIS to access healthcare, if you didn't have a card, you go into payment. They wouldn't say that they are delivering it to you cost neutral. So that cannot be delivery of free primary healthcare. More importantly, since the inception of the NHIS, as I speak now, it only covers 39.2% of the population and has been growing at a growth rate of 1.8% a year. If you look at our population growth rate of 2.2%, which has been consistent since 2010, it means our population is growing quicker than we are growing our national insurance. And that is how come the NPP tell us in their manifesto that they've increased it from 10.8 million to 12.2 million, which is true. But in terms of coverage, they've done nothing, because the percentage of the population that is covered has only increased by 0.2%. If you look at the NHIS data from when the MDC left power in 2017, and they quote these figures in the Ghana Beyond Aid document, they quote it in the Ghana Health Service Facts and Figures. You see, and so they start talking absolute numbers because they know when they talk the percentages, they'll be cut out. So they use the absolute numbers, and you then don't realize that, okay, in 2016, we were 27.3 million. In 2020, we are now 31.3 million. This is how much the population has increased. So if you even increase it from 10.8 to 12.2, that close to 1.6, 1.8 million doesn't mean anything, because the population growth, and critically, the people who are being added to the population are supposed to enjoy healthcare on NHIS free, but they are not signing up. So that should tell you there's a challenge with the system, because knowing Ghanaians, we love free things. So how come you're giving the person something free and they are not signing up? Because the easiest way to increase it is to use the net increase in population, which is the births over the deaths. So if everyone who was born was going on to NHIS, then they would deliver. So that's it. But the NDC in their manifesto say we are going to deliver it blanket. From 2021, we are going to start rolling it out. Now, here's the thing with the NDC work. If you look at our health per capita, outpatient per capita, which is the average number of times each citizen attends on a primary healthcare physician, it's 0.97, which means on average, the Ghanaian doesn't see a primary healthcare physician once a year. It's less than once a year, when you have to see a physician once every quarter, which is 4 times a year. So our patient per capita is woefully inadequate. And that impacts on our midlife mortality. And that is why our life expectancy is so low, because a lot of people are dying in their 40s and 50s with strokes and all those cardiovascular events because their hypertension and diabetes and angina is not being picked early. And as a result, they are getting complications. Say, oh, none of your power, suddenly he's dead. And we are not picking up from where it's coming from. So they are saying they are going to deliver it blanket. What does that mean? That means that suddenly they are going to shoot our outpatient per capita from the current 0.97 to about 2, because people will start accessing healthcare. Now, here's the thing. If you look at our health economics data, the delivery of primary healthcare to a Ghanaian is about $49 a year. That is even at our low outpatient per capita, which is in line with a lot of countries that have delivered UHC, like Brazil, Uzbekistan, and all that, who have actually delivered it. Those are the countries that you'd say are the flagship, Thailand as well. What does that mean? Currently, our health outpatient is 0.97, which is about 29 million people a year. You're going to increase it to almost 60 million. Multiply that by $50 and see the average cost of the MDC delivering it down their route. And then ask yourself, when it all catches on, and majority of Ghanaians, because remember the word is universal. So universal, you have to go above 90%. So let's say about 90% of Ghanaians are using it. What is going to be the cost? What is the fiscal space in our health expenditure as a percentage of our total GDP? There's none. Because if you look at our health expenditure to GDP ratio, the highest we've gone is about 5.7%. Currently, it's about 4.1%. With COVID, it's going to go down because out of that 4.1%, the government contributes only about 1.9%. The rest is from the private sector and development assistance. Already, the development assistants have started cutting their money because they have got to concentrate on their economies. So that's going to go down. So if then you look at it and say that within that sector, 60% of our health expenditure goes into salaries, remuneration, and emolument. 15% goes into running costs. So you are left with 25% for research, miscellaneous expenditure, and capex. That's infrastructure and all that. Where are they going to find the money to invest? So basically, the picture I've painted to you is that they have given us lip service without a very clear plan of what they want to deliver, knowing perfectly well that when 2030 comes, it's not if 2030 comes, because we all know it's going to come. We probably wouldn't have hit the indicators for delivering on the strategic and sustainable development goals, which then comes with some repercussions because it's an international declaration. I see a situation whereby, thanks to COVID, because I've heard murmurings in the WHO and all that, thanks to COVID, there would be a lot more breathing space given to countries because they would just assume that at least 2020 was lost through no fault of any country. Suffice to say, even if it wasn't lost, we didn't have a plan. It's not like we had a plan and the year has been lost. Even if it wasn't lost, we didn't have a plan. But that has given us some saving grace. So now we're going into 2021. They've all written this and they've not looked at the role of technology. Because the countries that have delivered universal healthcare have delivered it by leveraging technology. And what do I mean by leveraging technology? They've leveraged telehealth and telemedicine. And they have put healthcare in the palm of the citizenry. What does that mean? We just listened to a presentation on the economy. What you do is you decrease the carbon footprint of people accessing healthcare, because currently our healthcare access requires you to go to an outpatient department. We forget that the outpatient department is antiquated. It is a relic of the 19th century, where UK didn't have doctors, and they didn't want their doctors to move too far away from the very sick and infirm. So they rather wanted people to come to the outpatient department. So if there was an emergency, the doctor could run back and go and see the sick people. We adapted it and have made it the heartbeat of our primary healthcare delivery, which then means everyone is driving public transport and all that coming there. When, thanks to technology now, we can decrease this carbon footprint. The other thing around doing that is, currently, if someone says they want to access healthcare and you're an employer, they are gone for the whole day. Medical hospital means the whole day, you've lost them. If it's telehealth with a central repository where you can get mobile nurses, go to people's workplace, go to pharmacies, go everywhere and actually get the information, what then is going to happen is that people are going to increase their productivity. For me, this is the biggest lost opportunity in the two manifestos. And that is why I left it for the very end. They have, apart from trying to say, oh, this one's plan wouldn't work, this one's plan would work, X, Y, Z, they have failed to remember that the banking sector told us for decades that the reason why the market woman didn't put their money in the bank was because they were illiterate. But mobile money has proven to us that that was the biggest lie our society was told. It was because we hadn't found a banking system that meets the requirements of our low literate human resource. If mobile money has grown by 1,100%, if we do the same for healthcare, it can. So I'm concluding by saying universal healthcare is not an option. It is not a choice at this moment. It is something that we have nailed ourselves and our must to deliver. What I'll tell all of you is that the government doesn't have a plan, but I know one thing for sure. There are enough technological brains, enough doctors, enough researchers who can deliver this through an effective platform. And that is what we have to think about, because that might be the saving grace for the country. And that might be how we will get the best out of our healthcare system. Thank you.
Thank you very much. So much to think about, waving through all the declarations. I mean, if you're in the public health space, you realize there are so many declarations in different cities, and we are still waiting for them to be delivered, all the way into the need to actually leverage technology that will work to deliver service. So we'll just segue from there straight to Dr. Anda Nicolina. What are your perspectives in terms of applying technology across board, and how should policies be framed, or what kinds of policies would radically help us to achieve that level of integration of technology in our society that I would like to see?
Thank you very much. And I'm really happy that I'm speaking immediately after Kwame's very, what word am I looking for? A banger of a closing. Yeah. And I like the mention of telehealth and the idea that this would be the saving grace of, say, the health sector, meeting all those many declarations that he's run through, that we've chained ourselves to. And I like that because I think that in the 21st century, there's nothing you can really do without technology. Like the tech sector is the bedrock, is like the backbone of everything that we have to do. We have to do every sector of the economy must integrate into itself into the tech sector. And I think that that's like the most important thing right now that our governments need to pay attention to, because every sector right now, all over the world, to a large extent, depends on, is facilitated by the tech sector. And Kwame's talk of of telehealth, of the possibilities of telehealth, is really, really, really poignant in this particular point. So I wrote an article which was kind of shared quite widely. This is how Gameli got to know and invited me to this program. And it was I just tried my hands on scoring the NDC and NPP and their manifestos on the tech sector. And so the long and short of what I did was that I looked at the two manifestos on like what they promised to do in the tech sector and what they have done in the tech sector. So the two what manifestos, basically, the long and short of it is that the NDC's manifesto promised really, promising, ideas in the tech side, in the tech sector, including delivery of broadband access in the tech sector, and then the NPP's manifesto promised very vague things that are not really like groundbreaking. Things like I think the Ghana Post GPS, digital payment platforms, and things like that. Things that you can actually think, oh, these are nice things, but these are not generally things that you expect a whole national government to be doing. Whereas the NDC, taking taking a cue from, say, the South Korean government, which has basically the best internet platforms, broadband access in the whole world. And you can see the way the South Korean economy is growing in leaps and bounds, especially usually buoyed by the tech sector. So if you look at the two manifestos, the NDC, in the past, if you read through the manifesto, they boast about the broadband, the Eastern Corridor broadband that they implemented, and of course, they promised to implement more broadband access, including like laying broadband pipes, alongside our already existing internet, what's the name, electrical and water pipes and things like that. Those are sort of the things that other countries have done, especially municipal broadband providers in American cities like Chattanooga, Tennessee, and those kinds of things. So to me, the most important thing that you can do as a government is lay the groundwork for the private sector. And I think that before I came back to Ghana, I just came back to Ghana this year. Before I came back to Ghana, I was very, very pessimistic about the future possibilities of internet access and broadband access in Ghana. But what I realized when I came back and I actually looked at the investment that at least the NDC government has, seriously done in this sector, is that there's serious investment, including the laying of the broadband, the Eastern Corridor broadband access pipes, and the promise to lay those newer broadband pipes in municipalities to follow electrical wiring lines and water delivery pipes. So those two things sort of give me hope. And I think that if you go back to Kwame's point about telehealth, I think that this can really happen. You know, we can reach those things if the governments don't do like they usually do when a new government comes in. They stop the investment or policy platform that the previous government, you know, was trying to do. And I think that one of the things that I was really I found really disheartening by this current government is that they don't seem to be working with the 2012 Ghana broadband plan, that the national broadband policy that the previous, you know, administration, you know, put up. And I saw that like in their manifesto, they really didn't talk about that. They just talked about, you know, we are going to reduce data cost by this and that. And, you know, like those things are they are nice, but they are not really substantive. They are not groundbreaking to do things that need to be done to like to affect the entire population. So for instance, if you want to deliver telehealth, and I'm just keen in what Kwame is doing so that we can have a very interactive delivery. If you want to deliver telehealth, remember the people who will need to access telehealth the most are people who are in rural areas. Where in Ghana do we have the least access to the internet? It's in the rural areas. So if you are a government and you think that telehealth is one of the ways in which you can reach some of these goals that we've set for ourselves, you know, by going into all these treaties or declarations, then you need to broaden internet access to our rural areas. Now, as a government, you can't go and, you know, start delivering internet all on your own. At least we are a mixed economy, you know, for the most part. You need to do a private, private sector partnership with the government. And I think, you know, in my article, I talk about the model that the South Koreans use, where they do a lot of soft loans to the private sector, and, you know, to actually follow up on these important, you know, platforms that the government has already invested in. And they say that if we are going to give you, say, license to operate, you say that you would have to deliver, you know, to these rural communities, even though they might not necessarily be the most the most profitable, because for private operators, they only go where the profit, you know, is. And the rural areas, because, you know, they don't earn a lot of money, they also don't have a lot of population, because the larger the population center is, the better it is for your business. So what the South Korean government did, which I think that the government of Ghana can also do, is mandate that if we are going to give you a license to operate, you must also deliver, you know, internet or deliver broadband access to these, you know, rural communities. Because remember, a significant chunk of the Ghanaian population still live in rural areas, even though they are, you know, sparsely populated. They still live in the rural areas. So if we want to meet some of these goals, lofty goals that we've set for ourselves, we really need to focus on the rural sector. And we cannot do that just by leaving everything to the private sector. There must be rigorous and intentional government partnership. And some of these things the private sector would not like. If you mandate them to do something that is not necessarily the most profitable, they are not going to like it. But remember, they still need to operate in this sector because it's profitable. And other countries have done it. They are not, you know, you can't say South Korea is a socialist country because they mandate something. So we don't need to get into those ideological battles. Just need to look at the pragmatism of the policy. And I think that can also work. And also, if you look at another way you can do this, and I think the NDC's manifesto talk about this a little bit, and I think it's sort of like the Chattanooga, Tennessee system, where you have municipalities delivering broadband access by themselves. Remember, in Ghana, we only have 3 major operators. We have MTN Ghana, Vodafone Ghana, and then Airtel Tigo. In most places, it's only MTN and Vodafone. So if you leave these things to these private companies, oftentimes they are monopolies in the areas. You know, in my village in the Myong constituency, oftentimes when I go there to visit, you know, family, there's only MTN, you know, in the area. In some of the villages, it's only Vodafone which works. So they are basically monopolies. And when you have a monopoly, you don't innovate. You are not forced to work, you know, extra to deliver more to your customers. What happened in the US, and this is one of the things that, even though US has a better internet, one of the reasons why internet in the US is not as good as other, you know, very developed countries like South Korea, is that the private sector in many parts of the US are basically monopolies. So what this US city of Chattanooga in Tennessee, Chattanooga is a very conservative, you know, Tennessee is a very conservative, you know, state. But the municipal assembly in Tennessee decided that, okay, the private sector, the private mobile operators, they are looking at our rural areas, and they don't think that they can get money in there, so they just leave them. So what we are going to do, the city council, you know, decided that they are going to come together and, you know, operate their own broadband. And they invested. They basically laid the pipes alongside the already existing infrastructure. That is the electrical wires, and then the water lines. They laid the pipes, but the private sector fought them hard because they knew that immediately Tennessee did it, and they were successful. And in the U.S., Tennessee, Chattanooga has one of the best internet service in the entire U.S. Including they outcompete a lot of the private sector operators. So what happened is that the private sector knew that they would be forced to compete and to deliver at lower prices. So they fought the city government in Chattanooga, but of course they lost, because you can't you know, prevent a people from saying that they want to deliver something, you know, for themselves. So they lost. And Chattanooga, a number of American cities are beginning to adopt the Chattanooga model, where the municipal assembly also starts delivering their own broadband. And I think that the government of Ghana can institute policies where part of the budget that goes to the regions, the districts, some of those budgets could be used to lay, you know, to help lay those pipe, you know, what's the name? It could be used to lay some of those broadband access pipes, so that the municipal assemblies can start delivering their own services. And those ones can now become effective competitors to the private sector. In many cases, you are only going to be competing with MTN or Vodafone. And that can help, you know, increase the access to internet in most of our rural areas. Because if we just leave it to the private sector, it's not going to work. And so that's basically the core of what my presentation. And we talk about this whole presentation comes into like the tech, the experts and intersection with politics. And I think that if you look through the manifesto, the NDC has a probably better manifesto and track record of delivering the physical goods, which is very important, because you can't just say I'm going to force people to now do government business online, and then that means that you've delivered on internet access, which is one of the things that a lot of the NDC, like the MPP platform is based on. The government says if you are going to register for something, you must do it online, and they say, okay, this is an achievement. It's not an achievement. If you say people must do something online and they don't have money, they don't have the equipment to do it, you are not really doing much. So that's another point. I'm just remembering to talk about another point that again I reference South Korea a lot, because they've had the most effective internet penetration in the world. They have over 90-something% internet penetration. The South Korean government in the 90s and early 2000s one of the things they did was that they said PC for every household. So they started, buying, subsidizing, PCs and laptops for poorer South Koreans. Because remember, you can buy, you can lay the platforms, the broadband platforms in rural areas, but a lot of the rural people don't have money to buy a laptop. They don't even have money to buy, a smartphone, not talk of a laptop. So if they don't have access to those things, they can't really, participate. So one of the other things the government can do is to start, and of course we had a little bit of that policy, which again, one of the problems in Ghana is that policies, we have very nice policy ideas, but we have implementation problems. If you remember the RLG platform that the government was partnering with to deliver some, PC laptop for students in the in tertiary institutions, we could do something like that. And in the US, in places like South Korea, what the municipal governments do is that they partner with these private hardware operators like Dell and other things. And the government of Ghana can also do the same thing. Once you are buying in bulk, you can buy, with a lot of discount. So we can do that so that we can deliver more. So like every household must have at least a PC, so that if they need to access broadband, they can use that to access it. Because if you just leave it to mobile operators, because people can buy smartphones and use it, a lot of people in the rural areas don't have access. They don't have the money, they don't have the capital to buy these things. So these are some of the things that the government can do to make sure that they can integrate the economy into the they integrate the tech sector and the economy together to work in a way that helps a 21st century economy like the rest of the world. Thank you very much.
Very spirited input. I think one of the main debate areas that I've seen emerging from your presentation is, of course, the issue of investing in infrastructure, and also how do you then animate the infrastructure, because obviously it's one side building stuff and the other side is actually getting that stuff to be used, and for kind of like grow a whole ecosystem and business and activity and everything around it. Yeah, so I would like to also just give the floor now to Mr. Paul Osekwo from CDD to also give us some more perspectives, particularly from the policy side, as we are looking at this debate, science and technology. It seems on one side and politics on the other. We are trying to bring them to come together.
Thank you very much, Kameli. It's a privilege to be part of this conversation, and good evening to co-panelists and discussants available on the platform this evening. And I also want to recognize my D&D fellow, Mr. Fami Asiedu. He has done justice to the technical aspects of the conversation with relation to health. On our part at the center, CDD hosts what we call the Coalition for Domestic Election Observation Platform, which is called CODEO. CODEO, for every elections, implements a lot of projects or activities related to the pre-election, election day, and then post-election phase. So CODEO, since the commencement of the 1992, since the commencement of the Fourth Republic in 1992, has been involved in all the elections conducted. And most of our activities has focused on election observation, deployment of election observers for either in the long term or election day, and then the post-election environment observation. We've done peace education, civic education activities. We also have supported debates at local level for parliament, candidates for parliament at the constituency level. So we have not done much on manifestos as a policy positioning tool or policy positioning document that we we can influence its content and its formulation. So in the current elections, whilst analyzing the political context and the programming for our elections, we identify the relevance, the growing relevance of manifestos in our body politics. Because if you look at our politics has become very competitive in Ghana, in the sense that none of the parties can easily win elections relying on their strongholds. So this has driven political context closer to issue-based politics, issue-based campaigning, and then the relevance of the manifestos then comes in. And then if you look at the 2008 and the post-2008 era, you see that the various governments have focused on manifesto promise, trying to implement a lot of their manifesto promises. Then the challenge was that how can we influence the manifesto value chain process from the agenda setting or the drafting to the release of the manifestos? So at the agenda setting, we felt that it provides an opportunity for us as a think tank. And already we have a couple of projects on evidence informing policy. So if we are trying to inform policy with evidence and data, then an opportunity has arisen with the manifesto, which is the entry point where political parties use as a social contract to engage voters and to also influence their voting patterns. So how do we also get some of the advocacy issues that we've been hammering on with other actors, partners, collaborators, and stakeholders to drive some of the issues in the manifestos of the political parties? So we commissioned some experts, we selected some key sectors, taking into consideration how government business is conducted across sectors. You talk about the ministries, you talk about parliament, various subsidiary committees, how the various sectors that the government business is grouped under. So we selected 10 sectors that we focus on. The major science technology sector that fell into the 10 sectors was education. Unfortunately, I have Kwame Sapon-Asiedu, who served as one of the experts on the education sector. He has already spoken deeply about the issues in the health sector. Just so to having said this background about the work that we've done. So if you look at this document, sorry, if I have to share it, it will take a long process. So it's titled The Manifesto Project, Promoting Responsive, Responsible Manifesto for Inclusive Development. So we produced this document as a result of the work that we did at the drafting stage of the manifestos, whereby we were able to produce evidence and data, identifying the challenges, the problems in these sectors and their sub-teams, and making this data and evidence available to political parties and the media to be able to influence the drafting of the manifestos before the manifestos were released. Then the post-manifesto release we focus on the social sectors, health, education, and social protection. These were the 3 sectors that we conducted an assessment, including analyzing the fiscal space to see how government will be able to absorb, any potential government will be able to absorb its flagship policies and promise come 2021. So we did this work in collaboration with all the experts that were part of the project from the first phase to the second phase. So for the second phase I just also want to show you this publication as well. And if you are interested, I also make copies for you to have access to. So this publication is The Performance of Ghana's Economy and Capacity for Financing Key Medium-Term Flagship Policies and Programs. This document basically makes a very important caution that most of the promises that the political parties are putting across may be difficult to finance come 2021. And it is important that we demand more clarity, more explanation, more responses from government, how they are, from political parties, in terms of how they will finance some of the key promises that they've put in their manifestos. And one important thing is that we noticed in the manifestos that the two parties were all promising a lot of tax waivers, whilst providing or proffering a lot of freebies and offers that they want to give out to to citizens when they assume power. So the question is, what alternative funding mechanisms are they providing? Where are they going to get funding to really implement these kind of policies and freebies, especially in a post-COVID, or still within COVID? COVID is not gone yet, and our GDP targets have all been revised, and it's not likely we're going to do more than 1%. So it's a big question about the credibility of the promises that the political parties have been making. On the issue of science, technology, environment, we didn't do much work in that sector, because if you look at the 10 sectors that we focus on the governance sectors, we focus on the social sectors, and then we focus on the infrastructure and then the economies. We couldn't do much on the science, but I want to align myself with some of the lessons that we drew from working with scientists under the project. I noticed Frederick made a very important point about barriers against scientists in reaching out to policy conversations and policy discourse. Issues of victimization, issues of interest. He raised those points, and in our work too, we noticed that it's very difficult sometimes getting some of the scientists to take up this kind of work, assessing political party manifestos and preferring recommendations to enhance policy formulation and contributing to evidence and data that the media, because we also work with the media use the data and evidence that were produced to engage the political parties. So it's a big challenge that we need to find a way to build some kind of a critical mass of scientists across sectors who will really make their expertise available, or who will show interest. It's also important to look at the incentives for them. The current political environment is very polarized, and it makes experts find it very difficult, especially those who are really connected or rely extensively on government contracts and projects to really participate in some of these work. Then another point I also want to make is whether political parties see issues related to science, technology, and environment as a critical tool for attracting votes from citizens, and whether these issues really get attention in the manifestos of political parties. I think if you look at the rationale for manifestos, basically it's a document. First of all, it's a document that political parties are using to woo citizens to vote, or to attract them to vote for them. So in that sense, issues that are of critical importance to the livelihood of citizens, like job creation, reducing unemployment, responding to their health concerns, education, seems to attract seems to get the front burner, or get the maximum attraction, than issues of science, technology, and environment, and those stuff. So it's also a question as to how do we sustain conversations around this, such that beyond the manifestos, we may also target other spaces within the policy formulation process, like the NDPC, because post-manifesto transition process, government policies are expected to cut across sectors, and government cannot limit its focus or interventions to certain few sectors. Hence, how are we targeting the post-manifesto process, where the manifestos are translated into medium-term policy frameworks by the NDPC and other sectors? So that how do we engage those actors as well, so we are able to make these conversations quite relevant and sustainable? I think these are my introductory comments. I may not spend too much time because I'm sorry and I must apologize. There's another meeting that I have to join around 9 o'clock and I may have to drive. So I'll stay briefly for the next 5 to 10 minutes and then ask permission. Thank you very much. I know my director, Kwame Asiedu, D&D fellow, my senior colleague is around, and then he will do justice to the issues as and when they come up. Thank you very much.
Yes, thank you very much. It's been a very interesting and insightful submission. My big takeaway is that those of us in the science space, yeah, obviously I'm aware that we don't have much weight when it comes to politics, which is why we are having this conversation. But then we can see how our sector does not really carry much weight, especially in political discourse. So my first question to everybody, and I know Fred already started taking a stab at it, is that how do we grow our weight? How can science and technology be taken as like a major issue? How can we cause that transition?
I think I'd give that a start. You want blunt truths or half truths?
Want the truth, the whole truth.
See, I have been vocal right from my infancy as a scientist, right from my days as a lecturer in KNUST, through the Kufuor administration, through John Mahama's time when I sued the FDA, and I've been in the civil society space with CDD and all that. One lesson I learned with the current COVID pandemic is, even when you put out the raw cryptic data, not anything that you have done by way of complex analysis, but let's say official data that has been put out, but you've tried to stratify it so that the average person can understand what it means, you get attacked, you get insulted, you get maligned. A lot of people are not carved in that cloak where they want to take that sort of excess baggage on, because scientists generally are cloaked in a manner where you want to concentrate on your research, you want to concentrate on your null hypothesis, and you just want to get your outcomes, publish it in your scientific paper, defend it at a symposium or a colloquium or a conference, and just get on with it. You are more prepared to deal with the intellectual disharmony and the challenging of your outcomes than to deal with the unnecessary noise. However, it is the unnecessary noise that goes into policymaking. So we find ourselves between a rock and a hard place where we are making the right noises when it comes to our colloquium and our scientific papers and all that, but making the wrong noises because we don't want to be attacked politically. And therefore, even when we realize that things are going wrong, for example, you're all here, the government will tell you, oh, we're using science and data to manage COVID. You look at it and you look at the data and you're like, this is not right, that's not right. Why are you saying it? You are not saying it simply because you want to question the government or you want to let them look back, but you're a scientist. There's nothing perfect about science. And that is why you set your hypothesis and you go and people critique your methodology. So you are naturally a person where if someone puts out an outcome, you'd want to see the methodology and you would want to see the biases in the methodology and you would criticize based on that information. If you get insulted and you're not cloaked in that, you recall into your shell. Then what happens is that the scientific conversation gets off the back burner. The last thing I'd add is when it gets off the back burner, because naturally we do not have a large pot when it comes to our GDP and the fiscal space is narrow, other sectors claw in and chew up that resource. And then you get what Fred was talking about, where you find yourself looking for funding and all that from other people who have their own agendas. And that is why in scientific research, we all know at the end of your research, you've got to make a disclaimer of your funding sources and all those things. Unless and until we can decouple ourselves from all this malaise and say, you know what, like we're speaking on this platform, this is what we think, we're going to put it up, we're going to defend it. Like you see that likes of Fauci do in the United States, you see Sage do in the UK, and defend it to the hilt where we are like, you know what, this is what we believe. We have a lot of scientific history to back us, from Rutherford, Boyle, and co, where the fact that you believe in something yesterday doesn't mean it will be right today. But if you believe in it, you have to defend it until it is disproven. When it is disproven, you need to be humble and brave enough to accept the new way of thinking and move with it. We wouldn't be able to influence the space when it comes to the politicking because we are not politicians. And that is one thing we have to accept.
If I may just add a little bit to that. So what we really need is a tough skin. That's what Kwame is saying. The politicians will tell you need a tough skin. They have it. They've reached the stage where they're able to take criticisms on the chin and still move. So they are being criticized here, there are allegations here and so on. Some of them backed with evidence, but they just find a way to brush it aside and still move on. But we tend to cower into our shells once there's some kind of criticisms. And sometimes too, even we ourselves are not willing to stand up. So going back to COVID, the head of Ghana's health service is a scientist, right? But we do know when he was declaring that we've reached our peak and so on and so forth, that was really, it didn't make sense. At the time he was declaring we've passed our peak and so on, we hadn't actually passed our peak. And so we need to be forthright and defend what we know to be right, like Fauci and co will do, even if it means taking some personal discomfort, even if it means sometimes making people angry, or making people come at you sometimes. You need to, if you believe in it, for example, President Mahama was in the Central region recently, and he promised to build a coal-powered plant if he's re-elected. That doesn't make sense to me. And I've said this over and over again. And I've said this for him. If in the future somebody else comes up, say, Nana Akufo-Addo wins and says, I'm going to build a coal power plant, I should be, because it's based on principle, I should be able to tell him, no, this is wrong. My political affiliation or my political belief doesn't matter. It's the principle. That's what the Faucis and the Sages are doing. They know this is the right thing to do. This is backed by science, and therefore they go for it until, of course, the science is disproved. But we need to be convinced about what we are saying, and we need to go with it so long as we are convinced what we are doing is right. Sometimes it will bring some discomfort to us personally, but Galileo took personal discomfort, and today, and other scientists, and today we are all better for it.
Yeah.
So yeah. And then Kwame started by asking if he should deliver us the raw truth, and things like that. So I'm going to try and ask the same question and try to deliver something, a version of that. So I think that, you know, this question of should we stand up for what we believe or what we think the science or what we know the science to be right now, it's an interesting question to me, because the fact Fauci had a lot of protections in the US. In this country, they tell you to proceed on leave and there's nothing you can do about it. So you get up and you talk, and then you lose your, what do you call it, your ability to even influence the process. So that's something we have to be very, you know, mindful about. So even someone in the public sector who might not necessarily, who might disagree with the government, might say it privately, but no, you know, because he knows that if he does something, if he says it publicly, he's going to lose his position, and he will not even have the opportunity to even impact the process. So that's just one thing I would say about that. But the other thing, which I think is crucial, another truth, is that we have to understand something and just be honest with ourselves. The scientific community in this country is powerless. We have no power. Compare, like for instance, if you look at the US, the scientific community is keyed into the tech sector, like very keyed, like directly keyed into the tech sector, such that the private sector, you know, which is developing, you know, vaccines, and say for instance, like a lot of the universities host labs and other things who help these private sectors, health, like pharmaceutical companies develop drugs and other products. So these doctors have, you know, they have something to back themselves up. They are not just scientists. They are also keyed into the commercial sector. They are keyed into the money sector. In Ghana, we barely have that happening. I don't know if I'm overextending it, but we barely have that happening. So if you come out, you know, as a scientist without any of these backings that, you know, a lot of scientists in the US have, including legal backing and then commercial backing, you can't really say much. So that's a very important thing to, you know, that we have to really think about. So if we want our voices to even be stronger, we have to try and key ourselves into the private sector, and that goes back to what Frederick talked about in terms of research and those kinds of things. If we don't do that and we just depend on government for, you know, like government funding and those kinds of things, we will not have a lot of power to say a lot of things that we need to say, and so that the government will listen to us. That brings me to the second thing. In the US, and I mentioned the US because that's where I have most experience. In the US, government policy is directly related to what? The commercial needs of a lot of companies. A lot of, you know, we call it bribery in Ghana, they call it lobbying in the US. So in the US, you know, all these commercial companies, they pay a lot of money to the government sector, and the government does policies that, you know, they undertake policies. For instance, if you look at the Obama administration and how Silicon Valley became so powerful, it's because Silicon Valley basically funded Obama's administration. I'm not saying that's wrong, but I'm just saying that if you look at Obama's, you know, tech sector, you know, investment and all of those things, it's directly tied to what? The ability of that sector to fund the politics, which is real politics. That you can't get, politicians will not listen to you if you don't have much to offer them, and that includes their funding and things like that. So as a scientific community in this country, that is a reality we have to think about.
Well, very interesting question, very interesting perspectives. Okay, you want to respond to that?
No, I'm just adding something. You see, I also think that sometimes we are too sensitive I see the bit about where you get your daily bread from. And from the Maslow hierarchy of needs, you need to go food, clothes, and shelter. And then you need to go up until you get to self-actualization. However, I'll use myself as an example. You know what? When all this COVID thing was going on, a lot of people forget that the head of surveillance of Ghana Health Service, Dr. Asiedi Bekun, is my elder brother. I know Patrick Abuaje personally. Sarkodie, who was the director of public health, who my brother is taking over from, is my cousin. But when they made statements that we are peaked, I challenged them openly to it, my brother included, on Newsfile, on Joy, on GBC, anywhere we met. And I provided the scientific and statistical data to show that they were absolutely wrong. I told my brother that I owed Ghana a responsibility. And I remember on one particular Joy program, I said it openly to Patrick Abuaje. I said, we may come from the same womb, but we made decisions as professionals. He decided to go and work for government. I decided to work for civil society. Our priorities are different by way of how we contribute to the betterment of Ghana. It doesn't change anything from the fact that he's my elder brother. Neither does it change anything from the fact that I am his younger brother. Neither does it change anything from Sarkodie, who said that we had peaked, and I told him he was talking absolute nonsense. What people don't forget is, as recently as January, I was in Ghana for Sarkodie's daughter's wedding. That was the only reason I was in Ghana for 4 days. But when you have evolved in a society where they know that this is not personal, but we are dealing with an intellectual discourse, like Andani was saying, in the US, they do these things and it is tied to the job creation and industrial fortunes of the organizations. I work in civil society and my dialogue is tied to the advancement of social mobility and quality of health. I think as scientists, we need to have these small niches and we need to then start looking and watching each other's back. Because one thing I found interesting during all this COVID thing was you get a lot of my colleagues, in fact, in Noguchi and other things, picking the phone and calling me in England privately. They say, Kwame, you're saying the right thing. I said, well, so why don't you talk? Say, oh, because you're gone past it. Even when you were much younger and you came to Ghana to lecture, even College Kwashiga, you were taking them on and suing presidents left, right, and center. I said, yes, because I chose to do it. And I said, 20 years down the line, nothing has changed about me. If I had been scared then that I'll lose my job and I wouldn't do it, because then I was just newly married, I had a kid and all that, I wouldn't have been where I am today. And so I use those things to provide learnings for other people, that we can do these things. Sometimes we're too scared of our own shadows. And because we are scared of our own shadows, we don't watch each other's back. But if government realizes that, look, where's the Ghana Academy of Arts and Science? Where are professional bodies? When you speak up, these are the bodies that are supposed to back you. If they are not doing that, like you say about Fauci in the United States, you say he had backing. It was the American Medical Association that was backing Fauci. It wasn't any business. But Donald Trump knew that you touch the American Medical Association and your Surgeon General is going. It doesn't matter that he's a general in the army, he's going because his license will be withdrawn. We don't have that backing in Ghana, and those are the things that are costing us.
That's a very interesting viewpoint. I'm getting a few things here. One is, of course, taking the risk and engaging politicians directly, no matter the cost. Another one would probably be going into politics and deciding to use an evidence-based route and, as much as possible, support policies that really make sense as far as science is concerned. Another example is picking a cue from Kwame's book, where as a scientist who is active in the civil society space, you're not engaging directly with politics, you engage directly with politics, but you're also engaging on issues that are really important to people and society. And some of people can, of course, advocate on positions that are not necessarily directly politics linked, but can influence society one way or the other. So I think this is linked to a question that was just posted by Jekonia. I would like to invite him to actually put forward the question himself.
Okay, thank you, Gameli, and thank you, the panelists. You know, my name is Jekonaya, I'm from Zimbabwe, and normally, as a son-in-law to Ghanaians, I always have this keen interest of what is happening with my in-laws. So please don't be surprised that what is happening with this Zimbabwean in our affairs. You know, I'm just acting as an in-law. Okay. So my research that I'm doing, I'm from the University of Leeds. So I'm doing a research on, you know, the linkage between investment in science, technology, and innovation and development. So I've been listening through all the conversations and all the contributions. And one of the contributions from the first presenter was looking at this linear scientific knowledge transfer from science to political, you know, practice, which I think is the crux of my question there, that, you know, with this technocratic thinking that we have, because as scientists, when we're in our various fields, the whole idea is that all the efforts that we are doing are going to translate into, you know, development in one way or the other, or they are going to impact on people's lives in one way or the other, and which is what I call more of big D development. And it's more like based on that cascading downwards to every, you know, sector. But now you have a situation where politicians are faced with decisions that have to be taken to satisfy, you know, those immediate needs that we were talking about, maybe the basic, you know, needs, the daily imponderables that we have on a daily basis. So in most of our African countries where we are coming, there are issues of poor health facilities, access to clean water and all that. So the moment you talk about science or investment in science, there is likelihood of this resistance, not really resistance, but now, you know, more like prioritization, which is now very difficult at the political level. I'll give you an example. In Zimbabwe in 2019, when they were coming up with the national budget, the Minister of Finance mentioned that we have budgeted for satellites. We want to launch our satellites, you know, in terms of data and all that, space, you know, space science. And there was an uproar because during that time, doctors were on strike, teachers were on strike and all that. So people were saying, you want to go up there? Have you finished what is happening down here? You know, so I think that's the crux of my question, and maybe that's where science and politics come in and how to navigate within that space. Thank you.
Yeah, I think I get your sentiment. So why haven't you dealt with the smaller issues, and you are going to look at bigger issues, bigger concerns, and so on, and it's something obviously that drives what the politicians do or the kind of promises they make and so on. That's why I keep saying that we need to sensitize our people as well about the need for some of these seemingly useless policies or projects. Because, for example, if Zimbabwe were to launch its own satellites and so on, the benefits in the long term would be much more to the people than, say, giving them immediate needs or maybe subsidizing stuff for them. But people react more to subsidies, for example, on fees or electricity or food, than if they heard you are going to put a satellite in space. But then that's where we come in, to try and make people understand that that satellite going into space will eventually could make your internet cheaper or make it faster. And if it makes it faster, then your health systems could go online, like Kwame was suggesting, and so on. So we need to sensitize our people to understand the need for some of these interventions, so that then when it is being implemented, they can buy in.
Right. If I may add in, you see, to answer some of these questions, you need to go back into history. Like when Kennedy said, we choose to go to the moon, not because it is easy, but because it's difficult. We choose to go to the moon, not because it would benefit us today, but it would benefit generations yet unborn. We choose to go to the moon, not because we think we would survive, but even if we died, we would have died trying. That was ambition. That was ambition. At that point in time, when Kennedy came, his approval rating and all that, he didn't require going to the moon to prove to anybody that he could have done anything. But he did it because he wanted to do, and that is where we get the thing moonlight from. They say, what's your moonshot? And what's your moonlight? Because Kennedy unilaterally decided to set a country on a path that was altruistic from the thinking of majority of society. Today we know where they are. If you read From Third World to First by Lee Kuan Yew, a similar thing happens. Any one of you listening can go and read chapter 4 of that book when he came to Ghana. And he said by the time he was leaving Kotoka International Airport, he said Accra Airport, because at that time it wasn't, the coup hadn't happened. He knew that Ghana had a good leader, but had missed the runway for transformational development. And go and read that chapter. You'd realize that while he had come for aspiration, because he had heard Nkrumah speak, he had met Nkrumah and all that, he came to meet Nkrumah's ministers who were more interested in riding on the Queen's yacht that they had left in Akosombo, and the number of children they had who were in schools abroad and all that. Here was somebody who had come to learn from us, who was instead thinking of how he would get the younger generation of Singaporeans from universities in the United Kingdom to come and develop Singapore. At that time, Singapore's GDP per capita was 743, Ghana's was 900. Today, they are over 50,000 and we are around 2,000. Those are the things I'm talking about. So for as long as Africa continues to think around this way that, oh, bread and butter issues, and we are not prepared to break the bank and do things that our peers would think are way beyond the scope of comprehension and maybe expose our stupidity, our development might be teetering. And you see, anytime I look at Ghana and I read, I'm a scientist, but I read a lot. When I read even about the South Korean story, a similar thing happened between South Korea and Ghana. And that was how, if anyone who knows our history would remember Sanyo and Akasanoma, who were South Korean companies and Japanese companies who were manufacturing in Ghana. Today, what's Sanyo? Sanyo is Samsung. Where's Sanyo, Ghana? It's Graphic Road, dilapidated building. That is what thinking and ambition does. It sifts the grain from the chaff. Increasingly, because we are not exploiting our science, we are becoming chaff by the day. And every time the grain is getting sifted away from us. And we cannot continue down this route. We need to begin to understand that we have the same mettle as them. Because when we are in the UK, in the United States and all that, sit in the same classrooms, they are no better than us. It is our mentality that is what's defeating us. And the mentality is down to our social culture and our social enterprise. And we need to start breaking away from those things.
It sounds like a very nice sum up for today's chat. Yes, thank you for joining us. And I would like to say a big thank you to everybody. It's been a very interesting conversation. I'm a bit surprised that we've already reached 2 hours, so many interesting viewpoints. And I kind of feel bad in a way because there are so many issues like that we need to really go deeper and interrogate. But then 2 hours is also a very good use of our time. I think that it's nice that we have some content to start this conversation with, and in the future we will identify other strands that we can follow and build on this. I mean, the goal of Science Cafe really is to just create this platform where everybody, irrespective of their fields, and hopefully we can even scale it down to local languages to have this conversation about some of these critical topics about science and society and development, and kind of just create this consciousness, because again, sometimes when it comes to scientific work and research, there are two groups of people in it. They are either the scientists who are locked up somewhere in the ivory tower in the universities, or technologists who are busy behind their computers writing code and just really interfacing with society and connecting with, quote unquote, some of the things that matter is missing. And at the same time, when things like the climate crisis, a very slow grinding process, which is going to hit us hard if we don't react, or things like the COVID, which just shows you how science, or something that's like very important that has a scientific basis, that can act really fast and harm us. When things like this happen, we see scientific principles at play, and we see opportunities where we can really intervene to make things better. But then if the society is not scientifically literate, or people are not really conscious of these things, we miss the opportunity to impact, we miss the opportunity to solve the problems that we face. So yeah, this is a movement that will continue, supported by Global Lab, and of course supported by everybody. And yeah, let's continue engaging on all the topics that matter. Normally we normally take a group photo. So if you don't mind, please turn on your cameras. That's if you don't mind. And then I'll just do a quick snap, and then that's it. Awesome. Thank you very much for coming, and have a lovely evening. All the best. Bye.
Okay, bye-bye.